Hello, my name is Laurie Conklin. I'm a pediatrician and I'm a medical and regulatory director at ReveraGen BioPharma, and it's my pleasure today to give an update on the Vamorolone program. So we know that glucocorticoids, steroids, like deflazacort and prednisone, help to keep boys with Duchenne muscular dystrophy stronger for a longer time. They improve strength and mobility, they prolong arm function and ambulation, but they also come with serious side effects like weight gain and bone fragility, growth stunting, and Cushingoid features, which is that full face appearance and excess hair growth, suppressed immunity, and mood and behavior changes. Vamorolone was developed to be a novel anti-inflammatory drug. It's different from a corticosteroid in that it has a different structure, molecular structure. And the changed molecular structure does not change how it interacts with the glucocorticoid receptor, but it doesn't change how it interacts with the DNA in the nucleus of different cells. And so that difference in the interaction with DNA changes its activity. And in the lab, we anticipate that this would have a retention of the anti-inflammatory effects of the drug with a reduction in the side effects associated with prednisone. And that's why this drug was moved forward into clinical trials. We also know from laboratory studies that Vamorolone is an antagonist or blocker of the mineralocorticoid receptor. And that is similar, the effect is similar to eplerenone, which is used to treat cardiomyopathy in Duchenne muscular dystrophy patients. And it's the opposite effect of prednisone. So that also could bring an additional benefit of the drug to boys with Duchenne muscular dystrophy. And so that's why it was brought forward to be tested. This is an overview of clinical trials that have been conducted and are underway in boys with Duchenne muscular dystrophy. You can see from this upper left-hand corner that 48 boys who are aged 4 to 7 years old who had never received steroids before enrolled into VBP15002, this first trial. And then 43 of them extended on to a full 6-month study called 003, and then were able to continue on to the long-term extension study, which was an additional 2 years of treatment. These were open label studies, meaning that everyone was aware of the dose that these boys were taking. It wasn't a blinded study. This study, VBP15004, which is currently enrolling, enrolls the same population of boys who are age 4 to 7, who are still able to walk and have never received steroids. This is a 12-month study, and I'm going to speak about it a little bit further. It's a blinded study, meaning that both the investigators and the families don't know which group of the study that the patient is in. The chairs of these studies, or the doctors who have been leading these studies, are Dr. Clemens in Pittsburgh and Dr. Guglieri at Newcastle University in UK. And these studies are being run by TRINS, which is a neuromuscular contract research organization whom we work with closely, and who have also conducted and run the Cooperative International Neuromuscular Research Group studies, or the Synergy study. So this is an overview of this series of open label trials, and it just gives you a pictorial view of a little bit better understanding of the studies. In this first segment, boys were treated for 2 weeks with Vamorolone, and then they had a 2-week washout, which means that they stopped taking the drug for 2 weeks. And then they resumed treatment at the same dose for 6 months. And so this is showing the different dose groups. And then after the 6 months, as long as the dose was shown to be safe, they could escalate dose. And so these 2 lower dose groups escalated up to the 2 higher doses of 2 or 6 milligram per kilogram per day. This highest dose group, 6, the boys that started on 6 stayed on 6 by choice. And so this long-term extension period was 2 years, and the total period of time treatment in these 3 trials is 2.5 years. This graph, which has been published in an article that was published in Neurology, the journal Neurology, shows the 004 primary endpoint, which is time to stand from the floor velocity. And what is shown here is the mean change in velocity from baseline to 6 months. And the units here are rises per second. So it's how fast the child can stand from the floor. And this is change from baseline at week 12 and at week 24, 6 months. And so the red and the blue are the two lowest dose groups, 0.25 milligram per kilogram and 0.75 milligram per kilogram. Whereas these yellow and green are the two higher dose groups, 2 and 6 milligram per kilogram. And this purple dotted line is the Synergy Duchenne Natural History Study. So these are boys that were followed over time, but that did not receive treatment with corticosteroids. And so we do see improvement in the time to stand velocity at 6 months, and we saw improvement with all of the outcomes over 6 months of treatment. And again, that's been published in a medical journal already. So then we also have data after 1.5 years of treatment. So boys that have been on Vamorolone for 1.5 years that in the long-term extension. And so we now have 43 patients completing 2.5 years of treatment next month. We have data on boys who've received 2 or 6 milligram per kilogram per day, so the two highest dose groups for a full 1.5 years. And so this is data looking at the time to run walk velocity and time to climb velocity at 18 months or 1.5 years. And we're seeing here that the baseline is indicated by the black line, and we're seeing a continued improvement from baseline at 18 months. And we're comparing, we've lined up and shown data from steroid-treated patients in the Synergy Natural History Study. And so these are patients treated with deflazacort or prednisone. These patients were treated with different doses and different regimens, but it's just giving a general idea of that the effect is similar, and we see a change that's similar to steroid-treated patients. And it's encouraging to see that after 1.5 years, there's still improvement from baseline. We've evaluated the change in height percentile, so percentile for age from baseline to week 52. And we looked at patients who had only received 2 to 6 milligram per kilogram per day for a consecutive year. And so there were 27 of these patients, and we saw that there was no change in their height percentile, maybe a slight increase in their height percentile for age. Whereas in there was a clinical trial done comparing deflazacort and prednisone to placebo, and in this study, which was also a year long, there was a decrease in height percentile with deflazacort and prednisone that we did not see with Vamorolone. So it does not appear that Vamorolone leads to stunting of growth, which is a safety concern that is seen with corticosteroids. This is data showing body mass index after 18 months. So these are the baseline body mass index and the body mass index at week 24 or 6 months, and then the body mass index at 1 year. And this is the 2 milligram per kilogram cohort on the left and the 6 milligram per kilogram cohort on the right. We do see some increase in BMI in about 10% of patients. So you can see there's a few here that do increase in weight. But most of the patients, we don't see a large increase in BMI. So in summary, all efficacy outcomes showed dose-dependent improvements over 6 months. This was published in the Neurology paper. And we're also seeing that all efficacy outcomes show continued improvement after 18 months of treatment at 2 and 6 milligram per kilogram per day. And this study has been submitted to a journal, and it's under review currently. The efficacy of vamorolone seems similar to corticosteroids when looking at data from the Synergy Natural History Study, although we don't have any head-to-head studies yet. The VBP-15004 study has a prednisone arm, and so we will have data soon, but currently we don't have any head-to-head data. And biomarker changes, which were published already, argue against placebo effect as we see dose-dependent improvement in inflammatory biomarkers. So there does seem to be, we have evidence that the drug is having an effect on the body, and then we also have the corresponding improvements in outcomes, and these are dose-dependent. We also see an objective improvement, benign safety profile, so no growth stunting. The osteocalcin biomarker change looks different from steroids. Osteocalcin is a bone turnover biomarker, a biomarker of bone formation, and it looks to increase or stay the same with vamorolone, whereas osteocalcin is decreased with corticosteroids. The Cushingoid appearance is less frequently reported by physicians in the open label trial than it would be expected with steroids, which routinely lead to a Cushingoid appearance. And there are so far no serious adverse events attributable to the drug, despite about 70 patient years of exposure to vamorolone in boys with Duchenne muscular dystrophy. And this is our clinical trial, which is still enrolling at this point. And so we are seeking trial participants ages 4 to less than 7 years of age. We're looking for boys who have never used steroids. The study is a 12-month long study. And again, we're working with regulatory agencies and physicians to offer the drug under expanded access programs or compassionate use after the trial ends. So far, all the children who've desired to stay on the drug have been able to stay on the drug after the trial's finished. This is daily dosing by mouth at home. Visits are approximately monthly. There are no muscle biopsies involved. Every participant will receive study drug. The first 6 months of the trial, half of the patients receive vamorolone, a quarter receive prednisone, and a quarter receive placebo. But that's only for the first 6 months. After the 6 months, then all the children are receiving vamorolone for the second 6 months. And again, we are still enrolling. And so if you are interested, contact her here, Suzanne Gaglianone at ReveraGen or Andrea D'Alessandro at TRINS. Please reach out to them. We're happy to answer any questions. Again, this is an overview of this VBP-15004 trial that's enrolling now, showing us screening period, treatment period, and then treatment period 1, and then transitioning into treatment period 2, where all of the patients are receiving vamorolone. And we are working to ensure that children are able to stay on the drug after the trial ends. These are the trial sites in Europe and Israel. Please reach out. I know this is an extremely difficult time with COVID-19 and that there are a lot of barriers in place. And we at ReveraGen and at TRINS are working and doing our best to make sure that the trial can continue and we can maintain safety and study integrity. And feel free to reach out and we're happy to answer questions. This program has been made possible by many parent foundations and governments. We are so thankful to the Duchenne Parent Project, as well as other foundations and governments for your support.